Attention please, the webinar starts in 10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
This is IMAHRKMI.
When your heart is weak and tired, and your soul feels uninspired, when love turns into silent pain, and trust is lost in heavy rain, we stand with you, you're not alone. We guide your heart back home. We listen, we care, we heal with truth we share. We are here for you, to help your heart break through. Love can rise again, even after all the pain. With guidance, faith, and truth, we'll find the way for you. Hope will pull you through. We are here for you. That IMAHRKMI, we understand every wound, every broken hand. We see the tears that never show. We help your inner strength to grow. Online, we stand by your side, with healing, care, and guide. We are here for you, to help your heart break through. Love can rise again, even after all the pain. With guidance, faith, and truth, we'll find the way for you. Hope will pull you through. We are here for you. Relationship struggles, emotional pain, broken trust, silence and love. You don't have to fight alone. IMAHRKMI is here. Professional online therapy, relationship and couple healing. Hope begins here. We are here for you, to help your heart break through. Hand in hand, we'll stay. We will guide your way. No more fear tonight. You will find the light. IMAHRKMI with you. We are here for you. IMAHRKMI, healing hearts, rebuilding lives.
Good evening, everyone. On behalf of IMAHRKMI, I would like to warmly welcome all the participants, healthcare professionals, students, researchers, and guests joining us today from different regions. Before we begin, we would like to express our sincere appreciation to the leadership, administration, and dedicated American team of IMAHRKMI for their continuous efforts in promoting mental health awareness, professional education, clinical excellence, and global healthcare collaboration. My name is Zahra. I am a clinical psychologist with an MS in clinical psychology, specializing in CBT, trauma therapy, psychological assessment, and mental health counseling. It's my privilege to serve as the host for today's professional webinar entitled Self-Harm and its Clinical Understanding. This important session aims to provide a deeper clinical understanding of self-harm behaviors, associated psychological factors, risk assessment, intervention strategies, and evidence-based approaches utilized by mental health professionals. Today's webinar is being organized by IMAHRKMI, an international healthcare and educational organization committed to advancing mental health services, clinical research, professional training, and multidisciplinary healthcare innovation through collaboration with experts from around the world. Before proceeding further, I would like to introduce our co-host for today's session. Joining us today is Dr. Momal Aslam, Pharm-D, a clinical and retail pharmacist specializing in medication management, patient counseling, and pharmaceutical care. Dr. Momal will be supporting today's webinar, participant engagement, technical coordination, and the question and answer session. Dr. Momal, thank you for joining us today. Microphone is now yours.
Thank you, Zahra. Good evening, everyone. My name is Dr. Momal Aslam. I am a Pharm-D professional specializing in medication management, patient counseling, and pharmaceutical care. It is a pleasure to welcome all attendees to today's educational webinar. Throughout this session, I will assisting participants with technical guidance, audience coordination, and webinar management. In the event of any internet connectivity issues, audio disruptions, platform-related concerns, or technical difficulties experienced by either the speaker or participants, Zahra Ali, I will remain available throughout the session to provide support and ensure the continuity of the webinar. Thank you all for being here today. We look forward to an engaging, informative session. I will now return the microphone to our host, Zahra Ali.
Thank you, Dr. Momal. Before we introducing our distinguished speaker, I would like to briefly review our webinar guidelines to ensure a professional and productive learning environment. Webinar guidelines. Participants are kindly requested not to share their screens unless specifically authorized by the webinar administration. Please keep your microphones muted throughout the presentation to minimize background noise and maintain audio quality. Participants are requested not to turn on their cameras unless invited to do so by the organizers. Professional messages, advertisements, marketing content, external links, or unrelated materials shouldn't be posted in the chat box. We encourage all the attendees to focus on the educational content being presented. Following the presentation, We will open a dedicated question and answer session where participants will have the opportunity to interact directly with our speaker. Thank you for your cooperation and professionalism. It's now my honor to introduce today's distinguished speaker, Executive Director IMAHRKMI, Dr. Nabira Khan, a consultant psychiatrist, MBBS, MCPS psychiatry, specialist in psychiatry, clinical research, and AI-driven healthcare solutions. Dr. Nabira Khan has extensive experience in psychiatric assessment, diagnosis, treatment planning, mental health advocacy, clinical research, and innovative healthcare technologies. Her contributions to advancing evidence-based psychiatric practice and interdisciplinary healthcare collaboration have positively impacted numerous individuals and healthcare professionals. Today she will be delivering an important presentation on self-harm and its clinical understanding. Ladies and gentlemen, please join me in welcoming our distinguished speaker, Dr. Nabira Khan. The microphone is now yours.
Hello, everyone. Hope you all are doing well. And today we have a very pretty and very emerging discussion regarding the self-harm that is very emerging nowadays and very distressful condition we have. So let me share my screen and then we start our presentation. And if you have any question, you can ask in the end of the session.
Dear audience, कुछ network issue की वजह से due to some internet issue, our guest will rejoin soon. I'm sorry to announce that due to some internet connectivity issue, our guest speaker will join soon. Just please wait for a while. Thank you so much.
Okay, so sorry for the disruption of 2 to 3 minutes. Now we are starting with our very emerging topic and what the people call it among everyone that he is doing this thing for the sake of attention only. Or the people will always say this thing that he is just trying to or she is just trying to prove this thing, just take my sympathy and that's it. So this is not like that. If somebody is trying to self-harm, what do you mean by the self-harm? It's a very big term. For example, if you want anything, like if you want any juice, if you want any food, you can just go and give the money, right? But if somebody is cutting his hand, cutting his any body part or try to burn his finger or try to burn his any part of the body, just because he wants you or she wants you to stay in his or her life, that means he is or she is putting her life on the sake of yours. Just because of this thing, it's a very big term. When somebody is going on this point, when he or she try to hurt him or herself just because of you, so this is not just he is gaining the attention, he wants sympathy, or she wants just some money or something. She is doing it because she or he is not mentally in a sound state. He or she is hurt. He or she is very much disturbed that he or she cannot even explain his symptom by the verbal communication. So the only thing is left for them is just to make their body to speak out how much they are hurt. So you need to be very careful when somebody is saying or you see somebody's hand having multiple cuts, multiple wounds, having keloid type of injuries on the hand, you need to be very gentle to them, despite of being judgmental that maybe she just cut his hand to try to gain the attention, maybe he was just gaining attention. So today we will discuss the clinical management, what is basically the self-harm, how you can reduce the self-harm episodes, how the thoughts can be changed, how the physiology and how the psychopathology will play the role, what is the management, how you can even follow up with a psychiatrist or psychologist, and how you can stop these type of ruminating thoughts to just hurt yourself and get the relief. So please, next slide. Next. So basically, what's the self-harm? We have the definition, we have etiology and clinical scales as well. Let me define the self-harm, a rigorous biological and psychological framework to understand self-harming behavior, identifying risk factor and establishing baseline standardized measurements. The thing is, self-harm is a reaction. It's not any disease itself. It's a reaction of any painful thing that a person was being again and again in this situation. So this situation should be known as a risk factor. That what are the risk factors? What were the things that happened to this patient? Maybe in the childhood he was sexually abused. He never told to anybody. Maybe she was being sexually or physically abused by the grandparents, by the stepmother, by the stepfather, or maybe he or she is in any abusive relationship. So these are the risk factors that put a patient to just cut on yourself or doing the self-harm. Another thing, we have categorized it into the child self-harm behavior, adolescent self-harm behavior, and we have the elderly self-harm behavior. Why I just speak about the child? You see, the people who are just the age of school going 5, 6 or 7 standard, they started showing this behavior. They are just getting the sharpener their plate and just try to put their self-harm cuts. So sometimes the people of this age guess that it is a type of a very much Gen Z behavior. Just they are doing it. That's a maladaptive coping, that you are doing it by seeing your friend. That the person is not in any stress, but they are seeing it, it's a generational thing to do because you want to be cool at your school. So that is the maladaptive thing that you see other person and you start doing on yourself. So this is not the right way. We cannot say that this is the any type of disease, but this is the maladaptive coping. Another thing we have is the adolescent behavior that will come with a self-harm, having multiple wounds, having multiple cuts on the wrist, on their leg side, and some having the hidden spaces as well, burn marks, burning with a lighter. So these people most of the time have the relationship issues. Some spouse was getting cheating, some spouse get cheated by them, some having relationship issues, somebody's got very busy and they are not getting time, somebody is having spending time with someone else. So the emotion the other person was feeling was not able to tell that what I am feeling. So what they are gonna do, they just try to get some time of that emotion build up that they are trying to cut themselves. When somebody is trying to cut themselves, that means that person is deeply hurt. You didn't listen the verbal communication. There's a gap in the verbal communication that a person come to this point that he or she is doing it. Another thing is there's a word I will use, that is the insight. So what do you mean by the insight? Insight means that ability to know that I am having this disease or I am having this problem. If I don't have any insight or my insight is absent, that means I don't know about it. For example, we have some borderline personalities that don't have even insight that they are cutting themselves. They are just doing it and they say, I feel myself very relaxed once I cut my headrest, once I cut my nest, once I cut my foot. So they relieve the pain. So this is what we call the insight is absent. Because if you know what you are doing in your senses, you will never gonna hurt yourself. So this is what we can call the definition of self-harm. Next, please. So we have a clinical definition as well. That is, we call it, based on Oxford Psychiatry and Royal College guideline, self-harm is defined as an intentional act, self-poisoning, self-injury, irrespective of the precise motive or degree of suicidal intent. Self-harm doesn't always mean that you are going to do suicide soon. It always means that you want something that you don't want to tell or your verbal communication is failed. So function of behavior often several as maladaptive mechanism to regulate intense emotional pain, transfer psychological anguish to physical or communicate distress. Not and diagnose it, it is understand strictly as a manifestation of distress, underlying pathology, several depression rather than a diagnostic classification. As I told you, that it is a way to just explain your desires, your emotions. It's not itself a disease. It's a desire. It's a maladaptive coping that you are doing it. It's also the personalities. It's also the maladaptive coping things. Every person who is cutting their hand is not in a psychotic state. Remember my words. Maybe it's a way of their explaining about the emotions, right? Next, please. So, what do you mean by the biopsychosocial causes? It required that what are the biological markers or what are the things that is releasing in our body that causes us to be go to this level that we are doing the self harm. Physiological vulnerabilities, like we are having any type of trauma, we have any type of problems. What are the physiological stressors that made my mind to come to this point to just self harm myself? Another will be the social determinant that will play a very crucial role in self-harming behavior. For example, what your system say, like what the people around you will say, how they react, how their interaction with you. Are they isolating you? Are they trying to bully you? Are they trying to just harass you? Are they trying to try to avoid you? What type of social impact you are having on your brain? So first, we have the biological markers in which involve the HPA axis dysregulation, altered serotogenic pathway activity, genetic predisposition to impulsivity, neurobiological deficits, and emotional regular areas. So as in a very simple language, we have the happy hormones, we have the sad hormones, we have the angry hormones. When we talk about the biological markers, those we are trying to be our happy, those trying to the hormones that stabilize our mood will be in a dysregulation. When you are not even understanding your emotions, when there is an imbalance or dysregulation, you start doing the things you don't have to do. You start panicking the situation because the hormones that will be having some type of break that you don't do this thing, now they have the break fail, so they are doing the things what you shouldn't be doing in a normal situation, like having palpitations, having crying spells. And in the crying emotions, you are just take the plate and try to put the cut yourself, and once the blood was out, you were like, oh, I get a sound of relief. So these are the things are just showing that your dysregulation of the happy hormones, dysregulation of the mood hormones. Now, psychosocial vulnerabilities. So, severe affective instability, intensive self criticism, poor problem solving capacities, childhood development trauma, self injury for rapid evolution, or we can say emotional release. So, if we say as a child, I was the one who see that my mother was beaten by my father. I have a stepson as well. I have stepmother as well. Those try to hurt me. Those try to physically abuse me. Those try to neglect me when I needed them the most. So I have been raised by seeing this type of behavior. When you are just grow up with this type of behavior, what's in your mind? It's always in your mind that you are just get everything by getting the trauma. You will get everything, like you will be having reward, you will be having punished, but you first need to go through the trauma. So you feel like that my verbal communication has zero value. Once I just cut myself, the other person will try to give me attention. I make this maladaptive coping. I make this a habitual. Whenever somebody did not want me or I don't want anything and somebody don't listen to me, I cut myself. I just cut myself because this was the maladaptive behavior I have seen since the childhood. Another thing we have social determinants like chronic interpersonal conflicts, systemic isolation, socioeconomic depressions, exposure to peer, self-harming behaviors, negative social media, contagious effects. In the past, we used to say if somebody wants to know the person, just see their friends, how their friends are. Because most of the time you have friends about your nature. What type of nature you have that type of friends. So Your friends, your social environment will play a 90% role how you're gonna be or what type of adaptive coping mechanism you will adapt. If you have a circle of having antisocial personality people, borderline personality people, although you are a very sane personality, your personality will try to emerge or evolve around them, and you will get to seek their behavior. Their reflection will try to shadow you in a way that all the bad things, all the maladaptive copings, all the type of traumas they have, they just automatically, just because you are around them, you will get their energy. And in this way, you start self-harming behavior, you start the any type of sort of behavior that verbal communication have zero value, but self-harm having the 100% value because you want whatever you want. Next, please. So we have a clinical risk stratifications, like how you clinically assess this, what are the type of things, how you are domain lead tell about them. This is what we will do. We have the assessment domain like physical injuries, suicidal intent, dynamic markers. So if we have a low or minimal concerns, we have a superficial minor cuts, localized abrasions. That is very commonly people do this thing. We have clear intent to relieve distress and not to die. Like we want to just relieve our stress, but we don't want to die, because if we are on the verge of, you see, lots of people will come to the ER after attempted a suicide and they was well like, doctor, please save me. So their intent was not to complete the suicide, but their intent was that whatever I want, I will get this through. We have a dynamic markers like the protective one, like stable coping, support, this type of thing. Now, what are the moderate concern that take our whole of the attention? So they are the deeper injuries requiring clinical care, fluctuating one, ambivalent or unvoice intended, and the elevated one like substance use, socially withdrawal. Now, what we have the critical or immediate concern, severe poisoning or highly lethal means. For example, if somebody coming with organophosphorus poisoning, somebody coming with opioid toxicity, somebody coming with petrol sniffing, somebody coming with any type of solvent injection. If you are doing this type of things and you are just come on the support, that means you have a very much overwhelming emotion that built up with the time, and now you attended a very severe suicide. Even somebody who is, if we save them, they even attempted suicide just after relief from the hospital. So high intent in suicidal intent will be active planning and prepare to end their life. And imminent risk will be command, hallucination, and hopelessness. So these are the concerns and the type of things a people will do when they are trying to self-harm. From minor cut to the ending of their life by putting the poison on their body, by hanging themselves or strangulate themselves and letting their self to die. So every self-harm is not the maladaptive coping, but it can transform into the complete suicide if you don't give the attention. Next, please. So what are the scales? I know lots of psychologists over here, and we have normal people as well. We know that if I get any type of flu, if I get any type of headache, I have examination tool. I have the investigation tool. And what the tools are, for example, if I get the headache, my GP will order me just go and get the CT scan. So my CT scan will tell that which area of the brain is injured, and that's why my headache is arriving again and again. Similarly, if I have any sore throat or something, my GP will ask me to just go and give the throat swab, and you will see that what type of organism it is. If somebody having any mental illness, we don't have any type of CT scan or any type of test that we can tell a person that you are sick. We only have scales. So what are the scales? Scales are the basically questions that we provide in a paper form to a patient, that these are the questions that is asking that how you are feeling right now, how you are feeling in the past, how you are feeling 15 days ago. Are you a sad, more sad, worst, cannot even tell, crying and try to self-harm? we are giving the severity from 1 point till the 10 point or any other points. But the patient will mark it down the answer. I am feeling very sad today. I was feeling better than before, but I was feeling very, very sad today. And previous 15 days, I was a bit sad. So my patient mark it on the 2 or 3. At the end of the thing, we have lots of questions that are you just any way, just think about the suicide. If they say yes, we mark it down this column as well. We have, are you having a disturbed sleep? They mark it down yes. They have any other option that you are having overthinking behavior as well. You are mark it down yes. So in this way, we will score it down. We have made a category. We score it down like we have from 1 till 15 will be the mild one. From 15 till 30 will be the moderate one. From 30th till the 35, we have the severity. On the basis of severity, I will start my treatment, medication, as well as I will let my psychologist in a loop. So having a multiple session, unless your score on the scale will be lessened down. Every time you come to psychologist, every time you come to psychiatrist, they will provide you with a scale, and this scale will tell you that how you're feeling from severity to moderate to low. They will tell you that how your disease is progressing or your disease is going on the lower side, on the declining side. So we have 3 types of scales. Number 1, we have the Columbia Societal Severity Scaling. Another, we have the Saperson scaling, and we have the demo scaling. These are the scaling according to need of our patient. Your psychologist, your psychiatrist will decide that which scale should be applied on you on this point. Next, please. Now, the basic part of, I can say, of my whole of the topic is lie on the intervention. That we just discussed the pathophysiology, we discussed why it is going to happen. Now we discussed that what are the interventions, what are the pharmacotherapy, what are the support you can take from a person. First thing is a systematic exploration of evidence-based guidelines says and clinical community principles. Please go to the next. 3 types of therapies. What our guideline says. One will be the DBT, that is standard for borderline personality traits, focus on distress, focus on tolerance, emotional regulation, and mindful skills. Next will be the CBT, that will help you or that will help in cognitive or coping strategies. That will try to make your mind to be engaged and make your negative thoughts into a positive lightning values. Last will be the mentalization based therapy, that is having a very emerging thing. So first we talk about the dialectical behavior therapy. So in dialectical behavior therapy, those persons who had the personality, what do you mean by the personality? For example, I'm 19 years old. Now my personality is made from 1 year till 18 years. Whatever the things I have seen from my childhood, from my surroundings, it is now in my personality. And whatever I do, if I cut myself, if I try to just break my nail, if I try to burn my hand, this is what my personality is. And now you need to deal with the personality. So for dealing it, you will involve or engage a person to a dialectical behavior therapy. Your psychologist will take your sessions. Your psychologist will tell you that how the tolerance you have to develop for the stress, how the emotion regulations, your emotion should be regulated, not the dysregulated. What are the mindful skillness? Like, for example, the things if something come in your mind at that moment, what you need to do. For example, if that is come in your mind, I will take a blade and just cut my finger, and in this way I get a relief. That's bit of this. Whenever this thought come in your mind, just take a pencil and take a paper, write it down. That this several times, 10 times this thing come in my mind, but I write it down instead of cutting myself down. Or if somebody is in front of you and I just got the thought because of seeing that person to cut myself, I left this place and went to the shop and eat an ice cream. This is a healthy coping, that you just left the place. If you get the thing, you just write it down. If you get this thing, you just trying to play the carom, whatever you like it. So in this way, you just shift the focus from the anger issues and from the distress issues to the positive thing, even for the time being, but your mind will be shifted from the stressful to the present situation. Now, the cognitive behavior therapy, what it will do, it will change the perception of things. I will give one example that will easily help you to understand. For example, if a person will say, my boyfriend was not attending my phone because he is talking to another girl. Despite of this, I just did his cognitive behavior therapy of that girl and say, he is not attending your phone because he might be in the washroom and taking shower and he will call you back. So the negative perspective is shifted towards the positive perspective. So this is what the CBT will do with you. Now the mentalization based therapy, it will understand the interpersonal issues and emotional states. How right now you are feeling. How to change your emotions regarding somebody you will feel this much and try to cut yourself. Getting my point. Next, please. So the big thing is that if you talk about the self-harm, because it's not a disease, as I told you that it's a maladaptive coping behavior, right? So the guideline is say we have a no licensed drug to give any person. But for if somebody is having any co-mobs, because the repeated cutting yourself, repeated self-harming yourself, there was a moment will come that you develop the anxiety, you develop the depression, you develop the severe type of psychotic disorder as well. We treat the comorbid things, whatever arises just due to self-harming behavior. We treat them. So how we treat them? Depression, we will give the antidepressant. For psychosis, we give the antipsychotic. For mood specialization or anger issues, we give the mood stabilizer. Again, there is no licensed drug for the self-harming behavior, but the comorb, like what had in your past, you have depression, you have mood and symptoms, we will treat them, right? So these are the drug. Once again, we are trying to telling you the drug. The purpose of telling the drug is not like you can take the drug yourself. You will come to psychiatrists. They will tell you that are you in a state of mind that you will need the drug or not. Once your psychiatrist will be tell you, you will be able to go to psychologist, discuss your issues, discuss what is happening in your mind, and then you will be on the follow-up. But never try to take any type of drug. If you are feeling sad, if you are trying to cutting yourself, that the doctor tell me that this drug will do something wonders with me. No, because you are trying to take drug today, the next day your self-harming behavior was shifting from cutting yourself to taking drugs. Because you have this in your mind, my anxiety, my self-harming behavior will be reduced with this drug, so I will take right now. So the drug of use will be changed into abuse. So never try to take anything by yourself. Next, please. So safety planning, we have internal coping, work with patient to recognize acute emotional triggers, develop safe distress tolerance action, grounding exercise, cold water, delayed impulse techniques. Internal coping means you will tell the person how to stop yourself from the trigger and how to develop the safe surrounding. Safe surrounding means good friendly people, people who don't bully you, having a excess of the things that will be what right now happening to you, you have access. For example, if you are just going for self-harming behavior, you get panic, you have a water at your table, you have a writing pad on your table, so immediately you will get to your water and get the writing diary and pen with you, desperate of getting then finding the plate. Social crisis and context, build a list of trusted, supportive family and friends, include direct crisis and contact helpline. I know in people, most of the people will say that nobody around us can understand our emotions, but you have a social context everywhere. There's a need IMAHRKMI mate. If you need any help, we are 27 for you. We are 24/7 for your services. So anytime you feel like I am just going to die, I will cut myself because there is nothing left for me, IMAHRKMI is always there for you. You just have a helpline number, you just text them. If you have a shy personality, just text them anonymously, just contact them anonymously. Or if you want to talk on call, just call them and try to reach anyone like psychologist, psychiatrist for your help. So environmental safety actively ensure eliminate access to lethal means like medications, clinical storage, sharp instrument in the home or something. For example, I know my daughter get this self-harm behavior. I will, for the time of his or her therapy, I will let the environment safe by means. I will never send my daughter to kitchen because having sharp objects. I will make sure that there will be no any type of glass, no any type of sharp object in his or her room. My perfect thing will be like that. I will try to make my daughter to be slept with me at night just because might be she will try to strangulate herself. I will make the surrounding more comfortable for her, but not like 24/7 try to spy on him, but try to be friendly on him or her. Like, I want to be with you, I want to spend time with you, rather than I say, just because you have a habit of cutting yourself, I will be spy on you. In this way, a person's maladaptive coping will become more worse. Desperate of the say that I feel myself lonely, that's why I need your support. Should I come with you? This is the way you can give support to other person. In this way, they will feel that I am not the useless. Somebody wants me. So desperate of cutting myself, let I give support to other person. You shifted his cognitive purpose from self-harming to the need you wanted, just because you want to see him or her in a perfect state. This is the role a person, a friend can play on their part to just make the around or surrounding very safe. Next, please. Now we are having the last slide of our topic, and after that I will take the question answers from everybody. So what structure, core, and follow-up? Immediate phone call or crisis. I know lots of people, we have a stigma of society that if somebody will go into the psychiatrist, they are mad. They are totally insane, they are psychotic, they are manic. That's why they are going it. That's why IMAHRKMI being very kind to you, all of you. We made an SS to get our email, to get messages, to get call us. Don't go anywhere, don't go any out, don't try to find or just finding around and roaming around and get a long queue for the getting psychiatrist or any type of psychologist. Just message us or email us. We have the phone number, we have the hotlines, we have the email that is given below. This is the way you can, after getting the treatment, you can get the follow-up. So follow-up strategy will be based, maybe you just get the take me online consultation, and after 24 hours you're not feeling well, you can contact me again, because self-harm person can contact you anytime. Remember this thing. 1 to 2 weeks will be the standard time you will ask the patient to come and follow up, because might be I give medicines, that will be I need to ask that how the medicines are doing with you, what are the new changes on your body. 4 to 6 weeks, that means if I will see the treatment response is good, should I need to tighten it up or should I need to tighten it down? And then we have the 3 months plus, because if any drug I have started it, any therapy I have started it, it will take 3 to 6 months to be completed. And sometimes if your trauma is very worse, it takes one whole year to be with your psychiatrist. So this is all we talk about. And the last thing is I need to ask questions. I will welcome you all to ask the questions. This is what the self-harm is all about.
Thank you very much, Dr. Nabira Khan, for sharing your valuable expertise, professional insights, and evidence-based perspectives on such an important clinical topic. Your presentation has significantly enhanced our understanding of self-harm, risk assessment, clinical intervention, and mental health support strategies. We sincerely appreciate the time, knowledge, professional experience you have shared with our audience today. At this point, I would like to invite our co-host, Dr. Momal Aslam, to begin the question and answer session.
Thank you, Zahra. Firstly, I thankful to all audience who are participated in our program, especially Dr. Khatija, who are president in MRFI. Okay, we will now begin our live question and answer sessions. Participants who would like to ask a question verbally are requested to use the raise hand feature and wait for their turn. When your name is called, you may unmute your microphone and ask your question directly. For participants who prefer not to speak, you may submit your question through the chat box. Please include your name, your city, your question. Our speaker, Dr. Nabira, will do her best to address as many questions as possible. We appreciate your patience and cooperation while waiting for your turn. The question and answer session will now begin. The question and answer session will now begin. Please ask your questions, audience. Or you can speak in chat box, or you can open your microphone also. Or you can ask your question by raise your hands. All audience, you can ask your questions. If you have any question about this presentation, so you can ask any question. You can ask your question in chat box, or you can open your microphone and by raise your hands. Again, okay. Miss Alize. Yes, Miss Alize, you can ask your question. Please tell me about professional help in self-harm. Yes, Dr. Nabila.
Okay, so professional help will be like that. For example, you are in a state of depressive emotion, or you are in a very state of a anger moment. At the moment, you take help by our Hotmail ID, by our hotline number, by our email ID. You just contact them that I am feeling low, I need help. You need to type it down that I need help. So in this way, we got this know that you need help. This is an emergency that you need help. Despite of going for the self-harm card, you come to us. We will welcome you. We will guide you how to take a session, how to take to the psychiatrist, how to get to your psychological sessions. And in this way, we will tell you that next time even you feel it, how to cope with this type of thoughts. Rather than cutting yourself, what will be the physical thing we will engage to you. For this thing, you need to be message on the given below numbers or email on the email address, or you can call us on our hotline. Thank you.
Okay, anyone wants to ask question? So just raise your hands and you can ask any question in chat box or raise your hands. Or you can open your microphone also. Audience, you can ask your question through chat box, or you can open your microphone, or you can raise your hands. Okay, one more question, Octavia. Yes, Octavia, you can ask your question. What
Okay.
are the implications of relying on stated suicidal intent during psychosocial assessment?
Okay, thank you so much for asking this question. Very lovely question. The one thing is that, as I told you, we will just assess your severity of suicide or you're having a self-harm thoughts on the basis of scale. On the basis of scale, we will define that either you are a person who will be better by taking medicines as well as we can say psychological session, or you will be the person who will be get better with only the psychological session. One thing is that after taking your session, severity will be decided by the psychologist. That if you are in a state of a very severe state, maybe he or she will call you one day after. He will take the online session one every other day, one day or two times a week or three times a week, and then it requires 4 to 6 weeks to be just lessen down your harmful or your very irrelevant thoughts to be out, or will be safe 50 or 60% to be down, but it required the 4 to 6 week of period. But it is not like that in the 2 or 3 week you will feel the same. Your severity, your perception of thinking will be changed, but it required the 4 to 6 week to feel like a normal person, not to hurt yourself. Thank you.
Okay, another question, Patricia, you can ask your question. Okay, why
Okay.
is previous self-harm considered the strongest predictor of future self-harm and suicide?
The thing is that when we are considering a type of personality, we need to ask people that what are the things that is having in the past. Why are you are cutting yourself right now? For assessing a personality, to just differentiate it from a disease, we need to know that it is a habitual thing, that you are doing it since the very long, like you are doing it from the 12, 13, 14, or 15 years of age, or this is a first time thing you have started it. Or maybe you use any type of substance, any type of drug in the party that causes the change in your chemicals in the brain and try to do a self harm behavior. For getting a definitive history from the past, the current, we will decide your psychological, your medication treatment. That's why asking for the previous thing will play a very definitive role for your management. Thank you.
Okay, another question is Sally, you can ask your question. Okay. How should clinicians formulate risk when protective factors appear strong but suicidal ideation persist?
Suicidal ideation will even persist when you are just try to be well adapted with the coping. Why? Because the thoughts working on the thoughts will be always in the persistent state. Like you are taking session, your CBT is going on along with the DBT. If you are having the still thoughts, we will start with a medication that will try to change some chemical in your brain that will lessen the thoughts. With time, it will take either 3 months, 6 months, but your thoughts will be gone. Again, your thoughts will come back if your trigger will be around you. Persistent thoughts are just having a two, we can say, causes. One will be the you are not compliant to the treatment. Another will be the you have a persistent factor that triggers you. For example, if you are just cutting your hand just because of your stepfather, you are taking therapy from me every day, but your stepfather try to abuse you every day. So your trigger is all with you. You are living with the trigger. Persistent self-harm behavior is just because of your living with the stepfather. So you need to be move out from the trigger. Once your trigger will be over, once your therapy will be online, your persistent thoughts will be over. Thank you.
Okay, another question, Elsa, you can ask your question. Okay, what element distinguish a comprehensive risk formulation from simple risk categorization?
Okay, so we can say simple things like the formulations, the things we can do for a person is that we will tell them the mindfulness behaviors, we will tell them the mindfulness therapies, what they will do when the help is not at the table. For example, if you are not at the reachable point, you don't have any phone, you have not any access to us, what are the things you can do at your own? So the self-help will be the top of the priority in if we talk about the formulation of the simple element. Thank you.
Dr. Nabira, another question. Janisa, you can ask your question. Why have modern guidelines moved away from low, medium, and high risk classification?
It's just because if we don't know the severity, how you can treat the patient. Not everybody take the psychiatric medications. As you all know, the psychiatric medication will do wonders. Along with they have the side effects as well. So we don't put every patient on the psychiatric medication unless and until the patient is not needed it. For example, if somebody is having low thoughts 2 times a day or 1 time in a week, they can even take the therapy. They don't need any medication. For example, somebody come with a type of burning or cutting his throat or slitting his throat with any type of knife. That means this patient needs a serious help. So that patient needs the hospitalization as well. That's why we made a severity like less, more, or we can say mild, moderate, and severe. Thank you.
Another question. Alice, you can ask your question. What role does emotional dysregulation play in recurrent self-harm presentation?
Okay, as I told you that we have a happy hormone, we have a sad hormone, we have a mood stabilizing hormone in our body. So the brain will only get dysregulated or get into the manual functioning or get into the better functioning once you are taking the medicines. We need to see, a psychiatrist can see that either you need the antidepressant, you need the mood stabilizer, or any antipsychotic. In this way, the medicine will work on the receptor. For example, if your serotonin is not working well, it will upregulate the receptor. If your dopamine is not working well, it will upregulate your receptor, or your dopamine is hyperactive, it will lessen down it, or any other non-adrenergic receptors. Whatever the type of receptor, whatever the type of symptoms we are getting it, we will give the medication, and only the medication can work on the neurochemistry of the brain. Remember my words, medicine will work on the neurogenerative things, neurogenerative procedures, neurochemical processes, and we can say sessions and psychology will play the changes of the what you perceive things. So this is a two-way work. Thank you.
Okay, another question. Manuel, you can ask your question. Okay. When should clinicians suspect concealed suicidal intent behind repetitive self-injury?
Okay, so we will say by the history. History is very important. We will take not the history to the person, but we take the collateral account. That's why the collateral account have their very importance, or we have a wonderful importance in psychiatry. We always take the collateral account to the authentic person. Authentic person will be the one who will live with you, or the person who can tell everything about you. So in this way, we will know that what's the personality you have. Either there is a intended to suicide, or either it is only the intended to get the attention, just because the emotions he or she show in a verbal communication has lost their way. Thank you.
Okay, another question. Adin, you can ask your question. How does substance intoxication alter the reliability of suicide risk assessment?
Basically, when somebody who is taking a substance for a longer period of time, there will be a time come that you develop the tolerance. So it is not the body only develop the tolerance, but your chemical changes in the brain constantly changing and changing again and again. So there was a time come when your brain neurochemistry is typically changed, and now you get the fear of talking with anybody. You will say that somebody is trying to spy me, somebody is trying to persecute me, somebody put cameras on me, and you will come to the point, just because of the persecution, you try to self-harm yourself. You try to take suicide on yourself, just because your self-harming behavior just started because of the psychosis that was developed by the use of substance. So this is the reason. Thank you.
Okay, another question. Mika, you can ask your question. What are the ethical challenges when a patient refuses psychosocial assessment after self-harm?
Okay, so wonderfully, we are thankful to the native of psychiatrists that made a mental health act. Like if you are homicidal ideation, if you are having suicidal ideation, we have a mental health act to just admit the patient involuntarily in the hospital. This is what the mental health act will say. If you are trying to harm somebody else, if you are trying to harm yourself, we need to admit you involuntarily in the hospital to make yourself safe and other surroundings safe from you. So this is the first thing what mental health give us a advantage. So we save the person. Another thing, if somebody is dropping out from the session, this is not more ethically, but it is more likely the loss of the patient, because I cannot call the patient because I don't know that where the patient is, where the contact is. We can remind them that you have a session, you can come to us, but I cannot run on the patient. If somebody wants to help, they need to come to us. This is the thing. Thank you.
Okay, another question. Mika, you can ask. Anyone wants to ask your question? If you want to ask your question, so you can raise your hands, and you can ask in chat box, or you can open your mic also. If anyone wants to ask your question, you can open your mic. You can ask your question in chat box, or you can raise your hands.
Thank you to all the participants for your thoughtful questions and active engagement. A special thank you to our distinguished speaker, Dr. Nabira Khan, for sharing her expertise and providing comprehensive responses throughout today's session. We are also grateful to every attendee who joined us and contributed to the success of this webinar. Before concluding today's event, we would like to remind everyone that our official contact number has been shared in the chat box. If you would like to schedule a consultation, professional appointment, clinical guidance session, or obtain information regarding our services, please contact us using the official number provided in the chat box. Once again, our official contact number is available in the chat box for appointment scheduling and professional inquiries. I would now like to invite Dr. Momal Aslam for our final announcements.
Thank you, Zahra. We would like to remind all participants that our official contact number has been shared in the chat box. If you wish to book an appointment with any member of our professional team, please contact us through our official number or visit our website. Additionally, we are pleased to announce that our next professional webinar will be taking place within the next few days. We encourage everyone to join our upcoming educational session and continue learning with us. We are also launching our live professional program series beginning tomorrow, and we are warmly invite you to participate. Furthermore, IMAHRKMI has already launched several professional short courses with additional programs currently under development. Complete details regarding admission, course enrollment, certifications, training opportunities, and educational programs are available on our website. Whether you are seeking professional development, clinical training, research skills, or healthcare education, we encourage you to explore the opportunities available through IMAHRKMI. Once again, for appointments, consultation, admissions, and inquiries, please use our official contact number shared in the chat box or website.
Thank you, Dr. Momal. On behalf of IMAHRKMI, we extend our sincere gratitude to our respected speaker, Dr. Nabira Khan, our participants, healthcare professionals, students, researchers, guests, and the entire IMAHRKMI administration. We would also like to express special appreciation to a dedicated American team and international collaborators for their continued commitment to advancing mental health education, clinical excellence, and professional healthcare development worldwide. Thank you all for joining us today. We look forward to welcoming you again at our upcoming webinars, live programs, training courses, and professional educational events. Please remember that our official contact number remains available in the chat box for appointments, consultations, admissions, and professional inquiries. Have a wonderful day, stay safe, continue supporting mental health awareness and evidence-based healthcare. This webinar is now officially concluded. Thank you and goodbye.
सर इवेंट खत्म हो गया वीडियो प्ले करवा लो
Step into professional mental health education with IMAHRKMI, where expert-led workshops transform beginners into confident professionals. From hosting and back-end operations to IT management and coordinating speakers seamlessly. Develop professional creative skills including Adobe Photoshop and Filmora video editing, guided by IMAHRKMI experts. Learn to record and edit live workshops with professional quality, all within your training program. Guided by C instructors bring years of professional experience personally during each module. Stand out with a globally recognized American certificate issued by IMAHRKMI.
Gain hands-on experience simulating real online workshops, preparing you for professional practice.
Learn to host and manage online workshops efficiently and professionally.
Implement back-end systems and IT setups that keep your workshops running flawlessly.
Master speaker coordination, scheduling, and participant engagement techniques.
Design captivating visuals for your workshops with guidance from IMAHRKMI experts.
Edit recorded sessions professionally in Filmora to create polished content. Record each session with precision, ensuring high-quality content for your students. Collaborate with instructors, IT experts, and designers supporting you throughout the workshop. Learn from actual workshops conducted by our experts and discover best practices. Enhance your career with practical skills and an American certificate from IMAHRKMI. IMAHRKMI workshops are fully online, letting you learn at your own pace globally. Our workshops provide a safe, supportive environment for female students and professionals. Complete this workshop to gain practical skills, expert mentorship, and an American certificate to validate your expertise. Join IMARK and become part of a global community advancing knowledge, empowering professionals, and serving others. Welcome to IMAHRKMI, where new psychologists and students learn complete professional online workshop skills from senior experts. In our training program, students learn how to host professional online workshops step by step. You will learn back-end operations, workshop setup, and complete technical management. We teach how to manage speakers, participants, and live sessions professionally. Our course includes full IT training required to run online workshops smoothly. Students also learn graphic designing using Adobe Photoshop for workshop posters and presentations. We train students in Filmora video editing to prepare professional workshop recordings. You will learn how to record online events and edit them professionally. Our senior trainers are experts in their fields and guide students step by step.
This course is specially designed for new psychologists and students. Students gain real practical experience during training.
You will learn how to host webinars and online workshops professionally. Our training prepares you for real international level work.
After completion, students receive an American certificate from IMAHRKMI.
This certificate helps students build their career professionally.
You will be able to work in online workshops, webinars, and courses.
We are building an international team and inviting new students to join us.
Join our training program and become part of professional international workshops.
Learn skills, gain experience, and build your professional future. IMAHRKMI online workshop training. Learn, practice, grow, become professional.
Welcome to IMAHRKMI, the global platform connecting patients with top specialists from around the world.
Our team includes PhD psychiatrists, psychologists, sexologists, orthopedics, gynecologists, and surgeons providing expert care online.
Join interactive online workshops, short courses, and webinars guided by senior international doctors.
Collaborate with doctors from the United States, Germany, Australia, UK, Pakistan, and India. Become a member of IMAHRKMI, work with senior doctors internationally, and make your name in global healthcare. Gain experience consulting with international patients and expand your professional skills.
Earn an American certificate recognizing your expertise and professional growth.
Learn from senior international doctors, enhancing your skills in real-world online consultations. We are expanding our global team. Join us and collaborate with specialists worldwide. New platform is excellent. Agreed. Gain practical experience in patient consultations, workshops, webinars, and short courses. Our platform empowers female healthcare professionals to achieve excellence globally.
Connect with doctors worldwide and collaborate on international cases. Work with senior international doctors and be recognized globally for your contributions.
Membership gives you access to exclusive workshops, patient consultations, and mentoring opportunities.
Build your reputation, expand your skills, and earn competitively while working internationally.
Collaborate directly with PhD psychiatrists, psychologists, sexologists, orthopedics, gynecologists, and surgeons globally.
Enhance your knowledge through IMAHRKMI's short courses and webinars designed for professional growth.
Take advantage of this unique opportunity to work globally, gain international experience, and earn an American certificate. Join IMAHRK today. Work with senior international doctors, grow professionally, and make your mark in global healthcare. IMAHRKMI, advancing knowledge, empowering professionals, serving patients worldwide. Become a member and start your international journey today. Welcome to IMAHRKMI, the Globspeistens and Psychologists. Our team serves patients internationally.
Our team includes PhD psychiatrists, licensed psychologists, sexologists, orthopedic online from multiple countries. Short courses and webinars giving professionals a platform to learn and grow from senior international experts. Join doctors from the United States, Germany, Australia, UK, Pakistan, and India, and collaborate on patient care across borders. Become a member of IMAHRKMI, work with international senior doctors, and make your name in global healthcare.
Gain experience working with international patients, expanding your skills while making a real impact.
Earn an American certificate recognizing your expertise and professional growth in global healthcare. Learn from senior international doctors and mentors, enhancing your skills in real-world scenarios.
We are expanding our team globally. Join us and collaborate with specialists worldwide while advancing your career.
Gain practical experience in patient consultations, workshops, webinars, and short courses preparing you for international practice.
Our platform is supportive and inclusive, empowering female healthcare professionals to achieve excellence globally.
Connect with doctors from across the world, expand your professional network, and collaborate on international cases. IMAHRK gives you the chance to be recognized globally, working with senior international doctors and making an impact in patient care. By becoming a member, you access exclusive workshops, patient consultations, and mentoring opportunities from world-class doctors.
Build your reputation, expand your skills, and earn competitively while collaborating on international patient care.
Work directly with PhD psychiatrists, sexologists,
Psychologists, orthopedics from around the globe.
Enhance your knowledge with IMAHRKMI's short courses and webinars designed for professional development. Join IMAHRKMI today. Work with senior international doctors, grow professionally, and make your mark in global healthcare. IMAHRK, advancing knowledge, empowering patients worldwide. Become a member and start your international journey today.
Feeling overwhelmed, stressed, or unheard? What if you could talk to certified mental health experts, live from the comfort of your home? IMAHRKMI New York proudly brings you a free weekly mental health session. Every Friday, 2 full hours, with senior psychiatrists and psychologists. Join live on Google Meet, ask your questions, and get real guidance. No judgment, just support, understanding, and professional care. Led by experienced, internationally trained mental health specialists. Whether it's anxiety, stress, relationships, or personal struggles. You are not alone. Help is just one conversation away. Join us this Friday and take the first step toward a healthier mind. IMAHRKMI, connecting minds, healing lives.